Hello, everyone. I didn't know if I was going to make it into the Zoom room. My goodness gracious. I've never had that problem before. So it must mean that it's going to be very, very exciting with Russell tonight. Excited. Robin Yamamoto is who sponsored Russell. Russell's amazing. And he stayed up well into the night. Oh, let me make sure you guys can hear me. He stayed up well into the night. I think it's midnight over where he's at. Is it?
It is, yeah.
Yes. Oh, you're amazing, Russell. So I'm actually going to let Robin formally introduce you because she sponsored you. She gets to hear from your wonderful knowledge and wisdom and vision every single week. So, Robin, would you be so kind as to introduce Russell to the crowd that is continuing to join here tonight? We'll have more.
Oh, of course. You know what, Russell? I won't do it as good as justice as what you can do. All I know is when I met you and you told me about my gut health and my mitochondria, I'm like, okay, I need you on my team. So I don't want to mess it up, Russell. Tell us a little bit about yourself and what you do.
So my background is nursing, being a critical care nurse and cardiac nurse, specializing for the last 30 years. I've been an advanced life support instructor, so basically been saving lives on the cold face in the NHS and privately for the last 30 years. And basically, been studying many things: acupuncture, kinesiology, herbs, nutrition, plant medicines for about 25 years with a specialty in gut health and DNA repair.
That's
Love it.
amazing.
I
That's
love it.
amazing.
You had me at DNA repair.
Yeah.
I love it. And I love that you've been studying all things from herbs to supplementation to frequency and everything in between. So you are perfect. And what a perfect fit for you in the patches. By the way, how is the LifeWave patch business going for you over there, Russell? Tell us about that real quick before we get into the guts of this thing.
So LifeWave's just been incredible regarding not only the effect it's had for me, but also the effect it's had for everybody else that I put the patch on. And everyone I speak about it, etc. It's just been well overwhelming. It's been tremendous.
I love it. I love it. And I know that Robin had reached out to you because Robin, you were reaching out to all of these incredible mitochondria, kind of stem cell regenerative type people. And I know that you came across Russell, and I was on one of those first few meetings with you, and I was like, this guy's incredible. His knowledge is so huge and so wise. And so I'm so thankful that you've agreed to do this meeting, even though it's midnight your time. You look like it's 4 p.m, Russell. You look so sharp. So we appreciate you getting on, and we want everybody who's on also to be able to ask questions, I think. And so this is not going to be a typical meeting like we typically are flipping through flip charts. You've all seen that if you've attended anything that I do. We do a lot of flip chart presentations. It's many times the same thing, talking about this is it info, this is it team.com, right? We do a lot of that, but tonight is going to be super special because Russell's an anomaly and has such great vast wisdom when it comes to mitochondrial health. And like he said, he's just seeing miracles with these patches, with himself, with his clients. And so we really want to get into that. Now, Robin sent me over a little list of questions, but you know me, we might veer a little bit from that. It might not be just perfect because I have a tendency to be somewhat of a maverick, right? Yeah, we're going to put Russell as the pin so that I can just ask you the question, Russell, and then you're kind of front and center. But if there's anything that we do need to pull up, you know, on website wise or anything, we can always do that, right? Robin, you know, if there's something that, yeah, let's do it that way.
Yeah.
So Robin sent me over these questions, and I think she also sent them to you. So Russell, hopefully you were reading them thinking, oh, that one's easy, that one's easy, that one's easy. But these are some commonly asked questions that many people get. So, and again, for those of you who are brand new and it's your first time on here, or second time or third time, welcome. You're going to learn a lot tonight. What I would suggest you do is if you are on your computer, get your iPhone out and film the answers to these questions that Russell's going to give you, because they're going to be so thorough and so phenomenal. It's going to be something that you want to share on your Facebook reels or story with 1 minute increments. So first question, Russell, How does the X39 patch activate?
Very simply, as we know, you've got your patches. So I'm really inspired by obviously David Schmidt, our founder. So he's working on submarines with Navy SEALs in late 90s, mid 2000s. And I'm sure, like myself, as I heard the story, very simply, there's no natural sunlight on a submarine. Navy SEALs, covert operations, they're working at night or they're underwater. So again, no sunlight. So I'm sure you've all heard of seasonal affective disorder. So I'm sure that David, at some point, this is me surmising, not speaking for anybody, realized that actually, because there's no sunlight on a 3 to 6 month tour on a submarine, it's only artificial light. So that will blunt anybody's skills, even the strongest and the most experienced practitioner. So simply, I'm sure they realized that there is another source of light outside of artificial light, and that's our near infrared light, the thermal image that comes from the individual themselves. So by creating the patch, having that near infrared light shine back into your body at a specific wavelength, 12 patches, 13 coming, 13th coming, then that activates cryochrome C oxidase. Now, cryochrome C oxidase in your cell is really important for the electron transport chain to increase the methylation of your mitochondria, the mitochondrial methylation process. So without getting too scientific, basically imagine your mitochondria, of which you've got 1,400 to 2,000 mitochondria per cell.
Okay.
Imagine that being like a very dim light bulb, not really firing very well, not giving off a lot of light. By activating cryochrome C oxidase, you basically increase the wattage of that light bulb so it shines brighter. And as a result, that process allows the membrane to absorb oxygen, to turn it into water for the cell, to create oxygen, to create energy, forgive me. And that release of energy, increased by the mitochondria, increases the GHK peptide within the body. That GHK peptide likes to bond with copper, which significantly increases mobilization of stem cells within the vaginites of the gut, so gut health and DNA repair. Because as soon as the mitochondria, that bulb shines brighter on a cellular level all over the cells, about 120 trillion cells, depending on which you read. You start to shine from within. That's why the patch works so well. And very simply, we are allowing better DNA repair. We have further greater DNA repair than the stem cells created as a byproduct of that. Our stem cells 2.0 proliferate better cells and then basically receive greater healing, a greater nurturing of the body, and a more youthful stem cell being created each time and every day we wear the patch.
You know, when you're saying that, I just always think of people when they're in darkness, it creates sickness, right? So like when you're saying that they're in the submarine for weeks or months on end on these missions, of course, like it reminds me of solitary confinement, right? Like they put somebody in a dark place, they're not going to be well. I always say this is why nursing homes are not good, because they don't take them out into the light. They're all under the artificial light, right? Anytime, have you guys been in darkness in North Dakota here? Boy, if there's like 5 dark days in a row, we're suffering up here. So I've always thought that sickness in the body is dark, like tumors, cancer. It reminds me of dark energy. So just by putting the patch on, we're bringing more light into that darkness. And anytime you do that, there's going to be some restoration or regeneration or healing that essentially is happening. Is that correct to think like that?
Absolutely, 100% correct. Yeah, absolutely. Yeah.
That's it. I mean, so I'm like, you know, death and dying is dark, and living and vitality is light, right? And so we're just bringing light into the situation. So I love that. That you had a very thorough answer, much more than mine. Incredible, incredible, incredible. Okay, are there any side effects when you're on medication, when you're wearing the patch? What do you think, Russell?
Absolutely not. There's no medication or food in the patch. There's nothing for the medication that you're taking to interact with negatively. So because we're only using the body's ability to heal itself and using our own endogenous stem cells, those stem cells within our own gut, and because we're nano quantum organic computers, our own stem cells know exactly where to go to at the base core of any condition we have to then have a cascade effect of healing as a result. So there are no side effects because there are no medication or drugs in it.
Right. And I always think to myself, well, is there medication when you go outside and stand in the, is there an interaction when you go outside and stand in the sun? Now, if you're on a medication and they tell you absolutely stay out of the sun, well, then I would definitely use a patch, because guess what? You're not out actually exposing yourself to the sun, but you are bringing light again into the darkness of your situation. I'm over here feasting on dark chocolate so I can increase my copper while we have this meeting, just for the record. You guys wonder what I'm eating over here. So I love that answer, because we get asked it a lot. And if anything, I tell people it's going to help those organ systems to function better and more efficiently. So hopefully you're able to eventually get off of those medications with the assistance of your doctor. And again, let's just say this, let's let that be known. Like, you need to let your doctor know. How many of you realize you have to tell your doctor, I'd like to get off of this? Because if you're not telling that type of language to your doctor, they're not going to say, hey, we should take you off your meds. Right? You've got to actually have that conversation where you say, my goal is to actually reduce some of these medications, right? And when you start talking like that, then the doctor is going to know what frequency you're at. Because if you're waiting for your doctor to say, you're getting healthier and healthier, and eventually we're going to take you off of that blood pressure medication, that is not their job, okay? So you got to remember, they're looking at disease names and they're looking at the medication that goes along with that disease. And that is what they really are trying to do in our country for the most part. Not all of them, but a lot of them. Okay, ready, Russell? How does the patch know which peptide to target?
So basically, I describe it like you have specific wavelengths of light. So like transistor radio. So when you tune in transistor radio, you're getting radio 1, radio 2, radio 3. I'm in the UK, they're kind of UK channels. So so the same with the frequency of light. So David would have primed, what's the word? I'm looking for a word. It's late in the evening for me, forgive me. Coded the patch specific with the nanoparticles and amino acids to specifically reflect the frequencies that will trigger a specific peptide. Hence, you have different peptides, like different radio channels tuned in to the right frequency to release those peptides in the body. So I've had a great deal of success, for example, with the IceWave, had a great deal of success with all the patches, but specifically with the IceWave, which is pain control. So the reason why the IceWave works is, again, because it's releasing a specific peptide, which is going to be anti-inflammatory and analgesic to the body, which is why it floods that system. That makes sense?
Yeah. Mm-hmm.
Yeah.
Reflex 39 with the mitochondrial stem cell releasing, and other patches doing different peptides for different things to get different responses from the body that are specifically nurturing and beneficial.
Yeah, because light is information. And so depending on what the frequency, and like you said, like what the way it's being reflected, depending on those amino acids that he has in there. And by the way, let's talk about this. Many people don't know what peptides are, but peptides are somewhat controversial in the United States. I know some doctors that were trying to do peptide injections, and there's been a big kind of halt on a lot of that with our FDA over here, probably because it works, right? Anything that works, they're halting. Anything that doesn't work, they're full steam ahead, making trillions. Anyway, but peptides, for you guys that don't know, but our bodies are born with peptides. It's chains of amino acids. It's like protein. It's like sequences of proteins. And so what happens with peptides is, like when we're young, we've got a lot of GHKCU. When we're young, we have plenty of collagen. When we're young, our insulin is functioning perfectly in our body. Insulin is a peptide that most people don't know about, because we all know about insulin, right? So have you ever wondered why kids can eat all the sugar and don't get diabetes? You know, and then you do that at 60 and you're diabetic? Because our bodies are not as efficient at producing those peptides as we age. And instead of the controversial way of injecting peptide therapy like they do in the United States, that is where the controversy lies, David has figured out a way to activate these peptides with light. Woo! I feel like it's a jab, jab, hook, duck. That's what it's like with the FDA. Jab, jab, hook, duck. Right? So he's getting under the radar because we're not injecting anything. There's no needle, right? So which means there's a lot less incidence of infection. No incidence of infection, of course, with the patch, but you know, there's always risk of infection and a downside when there's a needle involved, right, guys? And so here, the fact that we're able to activate our peptides with light, it's literally like, let me tell you what it's like, because I love the analogy that you just gave of the transistor radio, because I give the radio analogy all the time when people say, I don't believe in frequency. I'm like, well, you've never listened to radio then. Because, you know, my big thing is, well, if I'm listening to K-Love, which is 88.3, I am not going to hear AC/DC Shook Me All Night Long. Okay. And I like AC/DC Shook Me Like. So I'm not going to hear that song on K-Love, but I am going to hear Nicole C. Mullins, My Redeemer Lives, right? So if you're listening to K-Love, you're not going to hear 80s and 90s rock. And it's the same thing as if I'm listening to an 80s and 90s rock station, I'm saying to my husband, why aren't they playing gospel over here? You're on the wrong station. It's a different frequency. Right, guys? And how I actually think about it now, I just had this visual while we're talking. When you activate the peptide with light, it's almost like you're on the radio station and all you do is you turn it up. You're turning up the volume of the radio, right, in the car. So if you got it on the station, we got the station because David's got that with the light. And instead of an injection, which is going to be here in a minute and gone in a minute, it's continually pouring that light into the body and just cranking up that peptide. That is so good, right? It's like tuning into the best frequency stations in your body that promote healing, and you're literally just turning it up. Turn up the volume in the car. You guys get that? That's good. I just thought of that. That was a good visual for me in my head. Sometimes things work out in my head for me. All right, here's the next one. Well, you've already answered this because someone said, does any medication go into your body? The answer to that is no.
Absolutely not.
No. Do I wear them daily or only when I'm hurting?
So I'd recommend absolutely you wear them daily. The IceWave, of course, we want to make sure we're wearing that so we don't hurt, recognize, but also the X39 specifically because we want to get to the cause of the hurting, heal it from the most essential point. Mm-hmm. Therefore, hopefully over time, the idea being that heals and you're not hurting any longer. So the core issue of the pain, which may not be the pain where you're getting the pain, as it were, makes sense. Right. So if you've got like abdominal pain, it may not be it may not be the abdomen that's painful. It may be another aspect of the body that's causing the pain, but is giving referred pain to that area. So we see this a lot regarding fibromyalgia and all different types of pain in the body. So I ask people, point to the level of pain, like the IceWave, point to the area of pain that most hurts. I had a guy with a club foot the other day. Born with a club foot.
What did he have?
A club foot, so deformed foot. So born with that, so I'm not going to change that with anything, unfortunately. So, but he was 66 and his pain was 7 out of 10 best and 10 out of 10 at worst. So when he woke up, it was 10 out of 10, had to mobilize his foot. He'd get it down to 7 out of 10 with mobilization. And then if he didn't mobilize throughout the day, so if he sat still for any length of time, it would be 8 and 9 out of 10. He'd have to mobilize again to get it down to 7 out of 10, which is still really, it is extreme. And then, of course, when he went to bed and woke up again in the morning, the pain was 10 out of 10 because it wasn't nice and loosened. Sure. So he's tried everything, all the main painkillers, the tramadols, the carproximols, the codidramols, had the injections, he's had everything. Put on the IceWave, obviously within 10 to 15 seconds, which is literally how fast it works. Always my experience of this. Sometimes it can take a bit longer. I've heard with other people, but pretty much within 10 to 15 seconds, peptides being released, anti-inflammatory and other analgesic effects, painkiller effects being flooded into that area. So we get his pain to 2 out of 10 within 10 to 15 seconds for the first time in his life. And then very simply, After we got rid of the main issue of pain, he then realized there was other areas of pain coming from other aspects of his ankle that he
Wow.
hadn't registered before because the volume of the previous pain was so high, he hadn't noticed there's other areas of his foot that were painful. Does
Wow.
that make sense? It's like
Yeah.
screaming in the room, not noticing someone's talking.
Yeah.
As soon as you get rid of the scream, you can actually hear the conversation happening. Tremendously powerful.
Yeah, that
Yeah.
is why we need to get people out of pain, because then we can actually figure out what's really going on, right?
Oh,
I'm going to show you something. I'm going to pin myself for a second, because I was taught this by a medical doctor, and some of you may have seen this and some of you may not have seen this. But so let's say that you have a point of pain on your body, and I'm just going to draw a point of pain. Let's say it's right there. Okay? And you can put that anywhere, wherever the pain's at. Well, like you said, Russell, there's a lot of times referred pain, deferred pain, you know, crazy types of things that's going on with the body. But I'm just going to pretend like this is the pain. That's not the United States. That's my pain frequency. So what happens, the medical doctor said, when you use the patches, you're actually trying to disrupt the pain frequency flow. Like you're trying to actually come in there and kind of disrupt, because pain actually is like a frequency, just like vitality is a frequency. So what happens is, let's say that you're taking the brown patch and putting it on the point of pain. Let's say that's the brown patch. You put it directly on there, take the sticker off. And then let's say you're going to go 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. I'm just going to put this down here for point of reference. You can see that backwards. I don't know. Is that right?
Yeah.
Okay. 12,
Yeah.
3, 6, and 9. And so then let's say that you put the first patch up here at 12 o'clock, and you put it about 2 inches up. Let's say you hold it. Well, do you see how it's hitting? It's in there, half in, half out. So someone says, wow, you know, my pain went from like a 9 to like a 4. It's crazy. Like, how did that just happen? Right? And then you say, well, let's try the next spot. Over to 3 o'clock, and you hold the patch right there. Right now, it's not up here. It's at 3 o'clock. And they say, oh my gosh, my pain is gone. Gone. It went from like a 9 to a 0. Do you see where that's at? And I say, well, let's just keep doing it for sake of conversation to make sure you're nowhere else. Let's get it over to here. Well, then when I come down here, they're like, oh, it's back to a 10. It's back to a 10. Do you guys understand why it's back to a 10? Because it's not in that pain frequency. You get it? And so then they're like, oh yeah, it's a 10. And then I go over here to this little area and see how that's outside of the pain frequency again. And they're like, yeah, it's still a 10. No. You got to go back over here, because when you had it at 3 o'clock, that's where I was 100% out of pain. And do you see why? So when someone drew this for me and showed me that, I'm like, that's incredible to know that that is why the IceWave is working, right? Russell, can you explain that? Like what I just saw a doctor do it, and he taught me it, and then I've just been teaching it. But can you explain to me why that's happening?
basically, we have different neural pathways affecting different areas of the body. So we want to make sure that, say we've hurt the foot. So we want to make sure that, so in the instance of this club foot, that the aspect of the pain pathway in which most pain is experienced is actually being localized. So we're actually putting the patch on that localized area that's going to deal the pain in that environment, in that particular area, forgive me. If we were to put it in his big toe, for example, and it's in his ankle, that's not the same neural pathway necessarily that's affecting that area of pain. Likewise, like acupuncture, we could put it on the knee, like stomach 36, for example, and then suddenly, actually, it's worked really well, but it's quite a distance. But it's still that neural pathway of pain that we're dealing with, and that area of fascia.
Are we talking neural pathway? Is it meridian, like my little guy over here on the wall? Like, is it all that? Like, it's all connected, right?
Yeah, absolutely right. 100%. Yeah.
So it's wild to think. And again, we haven't been trained this. I always think my homeschool is different than everybody else's homeschool, because we're teaching energy and frequency and light and Chinese medicine over here. So yeah, in addition to becoming billionaires, I'm so different than everything else. But I say to my kids, it's all about frequency. My kids all know how to patch. This, what I just showed you, my kids could all draw this because I've taught them it. and why the IceWave works. And I always thought it was when you say the neural pathway, I didn't know if it was that, or I was like, is it because of the positive negative charge? Because as you guys know, the white patches are positive. You guys know this? The white is positive, the tan patches are negative. And how the negative works in my mind, I heard somebody explain it like this, is like on an IceWave. Let's say you've got an area that has a bunch of pain on it, and it's just like, it's got so much like inflammation. When you put that brown patch on it, what I was told is it's almost like it pulls it up, pulls it out. And so I've actually had relief for some people where I didn't even use the white patch. Just by putting the brown patch on the point of pain, they're like, holy cow, it's gone already. Just by applying the brown, the negative one, okay? Because it's almost like, when I heard it explained, it's like, okay, it's too much energy. You got too much energy in one spot, and that's why you have pain. And so all that brown is doing is, it's like, I feel like it's like pulling it out or something. And
Yeah,
I don't know if I'm explaining that right, but
discharging negative chi, we'd call it in acupuncture.
there it
So
is.
as you needle a point, as we know, or we do pressure, discharging that negative chi, just giving it an access to get out. We could argue, absolutely amazing.
Wow. Discharging negative chi. I'm gonna start using that. That's way smarter than what I sound. Okay, next one. Do I wear the patch forever? And I'm just gonna say that I'm wearing it forever, but you can go ahead and give your answer.
So the answer is not strictly. We don't need to wear the patch forever, but why wouldn't you? As we get older, we recognize that every decade that goes past, the amount of stem cells that we naturally create significantly diminish unless we are significantly looking after our mitochondria. Hence, gut health and DNA repair is my specialty. So with all those who come to me through LifeWave and they wish to, I also then give them the information to say, hey, LifeWave is going to really help you. But if you really want to accelerate LifeWave, then let's polish and shine up your mitochondria. So many of my clients, for example, they're doing all the 8 ways to mitochondrial uncouple, which is the process in which mitochondria create energy. They uncouple, create energy, and therefore, in process of doing that, give enough time, often with intermittent fasting, which is the primary thing we can do to mitochondrial uncouple, the most effective thing to do. And we don't even need to change our diet at this point. We can seek the same diet and have a smaller eating window. So if we go to a 6-hour eating window, and we have 18 hours of fasting, so our insulin isn't being spiked, is what we mean. We can drink, etc. Then simply, we're allowing enough time, sufficient time for the mitochondria, of which you've got 1400 to 2000 per cell, to rest, repair, and rebuild. And the rebuild bit's really important. The rest is really important. The repair is really important, but the rebuilding bit's really important, because we know now that we've got 21 different DNA protein repairers. Many of us have heard of resveratrol. Some of us have heard of sirtuin, like the SIRT diet, lose 7 pounds in 7 days. Missing the point, in my opinion, because what we're doing is shining up that mitochondria.
Right.
And so even when some of my clients have done all the 8 ways to mitochondrial uncouple, including intermittent fasting, cold water, hot exposure, changing our diet, polyphenol, polyamine, lectin, phytate, and oxalate-free diets, polyphenol rich, all these things, they can still have very low mitochondrial methylation, which is the process in which mitochondria basically process oxygen into water to then shine brighter, that light bulb analogy I gave earlier. So add LifeWave, and then you've got the mitochondrial methylating far more effectively, even if they're doing really, all the things to mitochondrial couple. LifeWave for me has been a difference for many of my patients, especially those patients who are experiencing an oncological diagnosis. I found that very interesting, how suddenly they get the methylation of the mitochondria tested. It's very low. They go on LifeWave, and we see the increase in methylation on their blood, on their lab forms. It's really impressive. It's the missing link, literally, as far as I'm concerned.
Oh, okay. I want to add to this conversation, so I'm avoiding myself for a second. We, with our one son, Rocco, we had been dealing with some mitochondrial issues.
Something's wrong with your voice.
Oh, what's wrong?
Oh, there it
Can't
goes.
hear.
There it goes.
There.
Can you hear me
Your
now?
microphone.
Yeah.
Yeah.
Okay, okay. Anyway, Rocco was having mitochondrial issues for a while. We had spent 2 years doctoring with this gal down in Minneapolis, which is crazy. Rocco's never had a single vaccine. Rocco has not been on a single antibiotic, and he's 15. Not a single vaccine and not an antibiotic, okay? And you know how I eat. I'm radical. And so long story short, we were having all this mitochondrial issue. We didn't know what the heck it was. I had this gene testing. I was testing the whole family for MTHFR. We're all on methylated folate. My mom, by the way, doesn't have the MTHFR gene, which was astounding for me to find out. Anyway, we had been doctoring for almost 2 years and taking handfuls, thousands and thousands of dollars worth of supplements. And Rocco's mitochondria hadn't got a whole lot better. He couldn't take glutathione orally. It would turn his shins bright blue. They'd look like Smurf legs. It was crazy. It was just unbelievable what was going on. And so we got on the patch, and I just started everybody on X39 because that's all I knew to start everybody on. And 30 days later, we went back to this practitioner in Minneapolis. Her name is Nicole, and who's now in LifeWave. But Nicole tested Rocco 30 days after he had been wearing the patch, and I didn't tell her he had been wearing the patch. I didn't tell her anything about the patch. I just thought it's not going to matter because like he's on the supplementation and this is not a drug or nothing. So, I mean, it may or may not help, right? Well, 30 days later, she says, "Oh my gosh, what did you do to Rocco?" I said, "What do you mean?" She goes, "Renita, his mitochondria were typically the highest need. Like she would do some kinesiology and it was like a 0 to 900 scale and 0 to 1,000 and he'd be like 996. That's how high his mitochondrial need was. And in the month of wearing the patch for 1 month, the mitochondrial need fell off to like 250 after 2 years of it being in the 900s. She goes, "What did you do?" And I said, "We've been wearing this patch." And so she couldn't even believe it. And so then I hung up the phone. And then later on, she called me and she said, "Renita, your friend from Bismarck," because this gal was down in Minneapolis. She said, "I just saw Jalissa from Bismarck and who Jalissa's on the patch." And she said, "Jalissa's mitochondria did the same thing that Rocco's did." And she said, and Jalissa then told me she was on the patch. She goes, "I need this patch that you guys are wearing." She said, "I've never seen anything like this happen in mitochondria in 20 plus years of being a practitioner." So when you're telling me all this stuff about mitochondria, I'm like, oh yeah, we were the living examples of it because we had been spending thousands and thousands and thousands of dollars to no avail. And the patch literally in 30 days changed Rocco's mitochondria. And so when you're saying all this, I'm like, oh yeah, like this is so true. This is how it all works. And even with methylation, because I've had us all blood tested, and there was some high homocysteine and a couple of the family members, because I'm kind of radical, and so I'm getting everybody on methylfolate, actually methylcobalamin, but sometimes hydro or adenocobalamin. But anyway, the bottom line is the patch. As when people are wearing the patch consistently, guess what happens naturally to their homocysteine? It seems to go down, and maybe it's because all of the methylation is happening naturally because of the light, because of the frequency of GHKCU peptide. So everything you're saying, Russell, my family's over here like walking this out as living examples. I just wanted to say that if you're on here and you don't know much about mitochondria are the powerhouse of the cell, and when they're not working, nothing's working. So you need the mitochondria to be working appropriately. Okay, moving on. I also want to say on the do I wear forever? I've been telling my son, Bo, when people ask that question, do any of you have any bad habits? Raise your hand if you have any bad habits. Anybody on here have bad habits? Okay, anybody? Don't lie. Some of you are putting a pinky up. Do you have bad habits? Everybody's got some bad habits, right? Nutritionally. Any nutritional bad habits? Oh, you never eat fast food? Okay, well, I don't, but like maybe you do. Never drink alcohol, whatever. The bottom line is we've all got bad habits. You know what I say to my son now and my boys? Quit all the crap that's hurting you and keep doing the stuff that's working well for you and helping you. And the same thing goes for the patch. If the patch is helping us and helping to reverse aging, like you said, and resetting these genes and doing all this to our mitochondria, why in the world would we consider stopping something that is so good? Just make the list of the bad crap you do and check mark one of those and stop those instead. That's my advice. Okay.
And
That's
as we know, Rin, sorry, forgive me, but as we
right.
get older, we create far less we create far less stem cells, and we have far less cellular mitosis. So our cells, as we get older, certainly as we get into our 70s and 80s, our cells just simply stop dividing. And this is why we see the Western idea of old age. We literally get small, we lose weight, our skin we lose the collagen, we lose weight, we start hobbling around because our cells are no longer dividing, because we no longer have the stem cells within our gut, because we stop producing them. So X39 consistently keep that process of cellular division and cellular mitosis and stem cell creation going. So I've got an 80-year-old landlord. His name is Jeff. You'll see Jeff on my website. He has done a testimonial for me. But the conversation, we grew back his hips. This is before X39. It took us 2 years. Now, if I had X39, I think I could have reduced that to about 6 to 8 months.
Wow. 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 I'm at the point in my life where I think every disease is curable and reversible. That's just where I'm at. And you just have to keep seeking. And anyway, we could talk about that all day, but wow, what an incredible story. Yeah, we see, Gina Merritt's story of, like now she's got the bone density of a 25-year-old and she's 62. I mean, come on. Like, yeah, I'm never going to stop wearing this thing. It says, if I stop or miss a patch, will my ailments return, Russell?
So it depends how long you've been wearing the patch for. If you've been wearing the patch for, say, 3, 6 months, a year, then depending how deeply embedded, for want of a better word, that your illness was, so 10-year illness, 20-year illness, 1-year illness, then the idea being we want to create DNA repair so that you no longer experience the negative genes being, the wrong genes being turned off, the right being turned on is what we want to get to. So hopefully we've rebuilt ourselves within that time. However, we recognize that if we keep doing the things we've always done, we're going to keep getting the results we always got. So what we do know about gene therapy and DNA is your health has nothing to do with your genes, which is a really like, what? So just because your mother had something or your father doesn't mean you'll get it.
That's right.
But what it does highlight is simply if you do the things that your father did, smoking, drinking, eating high-fat diet, eating high-carb diets, poor-fat diets, then you're going to get the same symptoms that he had, heart disease, cancer, gout, who knows. If you change that and then you heal and continue on that healing journey, then the likelihood of you experiencing those symptoms again are going to be significantly reduced. But as soon as you do get those symptoms, then that's your indicator to go, oh, I know with this slippery slope, I need to get back on my healthy lifestyle again. And again, use the patch. But we want to recognize that genes have nothing to do with our health. Lifestyle will trigger the genes that create ill health if we don't pay attention and listen very closely to what our body is telling us. Brain fog, malaise, pain, and there's a whole litany of generalized symptoms it's hard to put a finger on. And then, of course, if we continue down that modality, then we will start to go to the doctor and they'll start diagnosing stuff. And then we've got a label and then we've got medication. And we think,
yeah,
when we could,
it goes from bad to worse. Trust me.
Yeah.
So 15 years ago, maybe it was not quite that long, maybe 14 years ago, I was over in Singapore, and I'll never forget the doctors talking about epigenetics. And it was the first time I had heard the word epigenetics, which means above genetics. And I realized at that point that it is not about your genes, it's the environment that your genes are in. So like you said, it's the nutrition, it's the lifestyle, it's the lack of exercise, the water, the thinking patterns, even the spiritual nature of things, right? Everything is affecting our genes getting switched on or off. And so just because something runs in your family doesn't mean it runs in you, right?
Oh.
Yeah. So that whole, diabetes runs in my family, cancer runs in my family. Well, that's because like you said, you have the same lifestyle as your mother, your grandmother. And if you decide to change that lifestyle, then then the genes, you're not at the mercy of your genes. That's the truth.
Absolutely not. Yeah.
And if you're still thinking that you are, you can let that go now, because they proved that not to be true. Like, that's not true. You're not at the mercy of your genes. And even with genes, like, none of us have bad genes. Like, I've read this book, Dirty Genes, several times by Dr. Ben Lynch, and maybe you've read it, Russell, but this Dirty Genes, he talks about, it's like genes are neither bad nor good. They just are. That's your genes. And then just learning how to, the cofactor nutrients, the nutrition that you need that needs to go along to turn on the right genes, turn down the wrong genes, right? And so as soon as you understand that, you realize just because something runs in your family, it can stop with you. Okay. So don't think for a second, heart disease runs in my family. Sometimes I think that's a poor excuse to continue the poor behavior. So like for me, I never use that as an excuse. I might have similar genes to my mother. But guess what? Wow, I know way more at my age than she did, right? At my age, right? And she never exercised, she never ate healthy, she ate fried food, and she was in a very, very stressful relationship. And so I think to myself, all of those were factors that epigenetically were not good for her. You know what I mean? And so, but I can make the change. We can all make the change. All of us can choose today to choose differently about what genes we're allowing to turn on or off. So if a doctor says, well, it's genetic, I just even hate it when they use that terminology. You know why they use that terminology? Because the medical community does not know root cause. You know, they're not trained that in medical schools to know root cause. You understand that when you go to your medical doctor, he doesn't know the root cause of why you've got something. They don't know that. That's not what they're trained to know. They're trained to match a medication to a problem. Okay.
Yep. New doctor.
Go ahead. Does someone want to ask a question?
No, I just said new doctor.
Yeah,
New doctor.
doctor.
Yeah. That's why second opinions, right?
Yeah. Or hire Russell. Russell is available. That's what he does for a living outside of LifeWave, is he does consultations where he helps people get their genes and genetics and mitochondria and everything on track. Okay, so he says, can I change my physical health condition by patching? That's another question. Can I change my physical health condition by patching?
Yes. If it's not congenital, so I gave the example of the club foot. So we recognize that a club foot is a foot that's just from the genetics of as we grew, is malformed. Okay, right. It's got toes and it's got a foot, but it's just smaller and not as developed as the previous foot. That's okay. Or the other foot. That's not going to change. But your symptoms experienced by that foot can significantly be mediated by using the patches, such as my example with IceWave. So your physical conditions will absolutely get better, because that's what we find consistently with everybody that uses the patch. If I can give you an example. So I was glamping the other day, so glamorous camping last weekend. It's a very quick example in the sense of, so came on site, people know what I do. So they said, hey, Russ, can you come over? I've got a lady here. She's got just simple hay fever. So I walk in the tent, she's got a very red nose. She's obviously pouring with mucus. She's getting very itchy, and she's saying to me on a Friday at 2 p.m, if I stay for the weekend to have this celebration, then it's going to get significantly worse. I don't like taking medication. I think I want to go back to my apartment, home, outside of nature, back in the city, to reduce the symptoms. I had no other patches but my last X39. So I said, I don't know if it's going to help. I'm going to pop this on your back if you're happy. It's light therapy, but light therapy in a patch. All allergies from a Chinese medical perspective are small intestine related. So as we recognize that hay fever coming from the small intestine, then I'm like, okay, symptoms are obviously respiratory, and skin, but the cause is small intestine in my worldview. So that's going to be localized to the stem cells in your gut. So let's have a go. Pop the patch on her. Okay, so that's 2 o'clock in the afternoon on Friday. She goes to bed quite early with her partner about 8. I didn't see them until the next day about 11 a.m. So on the Saturday, 11 a.m, I'm like, hey, how are you feeling? Absolutely zero symptoms. I put the patch on. I drank the water like you said, Russ. I've got no symptoms. I've got no, I'm not dripping any longer. I'm not sneezing. The redness have gone. I've got no itching. I've never had anything like it in my life. She's about 36, single mum. And where can I find these patches? This has not happened. Usually it gets worse over the weekend, and I have to go home to my air-conditioned, non-pollened environment. It was a game changer for her. So simply changing stuff. So everybody who's had the patch, in my experience, and of course through LifeWave's experience, definitely have an increase in physical health and a decrease in negative physical symptoms.
Wow, I love that story. I love. How many of you love that story? I just recorded it because I'm marketing is everything and everything is marketing. So I'm sitting back recording Russ the whole time. Like, pour it out, Russ. I'm putting this out later. By the way, we're not treating, curing, or preventing disease over here. This whole Zoom is for educational purposes. So hopefully you're getting educated because it is very, very educational. I love that story about allergies, and because a lot of, are any of you dealing with people with allergies right now where they're saying, what can I do? And it's interesting when you say in Chinese medicine, that's small intestine related. Very, very interesting to me. Love that you shared that. All right. Do medical doctors approve of this patch, Russ? What do you think?
Once they understand how it works and why it works from a biological level, absolutely they do. And once they use it and see it, they're like, wow, why have I not been told about this before? And then we know the answers to that. So I'm not going to go there today.
Yeah.
But simply, we recognize that proof is always in the pudding. So I have been used to, as an intensive care nurse, so obviously critical care, intensive care environments, high dependency unit, coronary care. People got chest pain, people in extreme trauma. We give IV morphine, we give IM intramuscular pethidine, oral tramadol, fentanyl lozenges, the works. I've never seen anything work as effectively and with zero side effect as LifeWave.
Yeah. Oh,
Because
wow.
people see that, and I think pain is the biggest thing. So for those who want to patch, then the most incredible transformations personally that I've seen with patching people, both clients and also people hanging around, you know, sort of where I am, and got headache, had a patient with client. I had a friend who had a terrible hangover, had a headache, patched her head, had a friend who got terrible gastrointestinal pain through whatever, and patched their abdomen, 10 to 15 seconds, literally every time. Pain goes away, and they're like, wow. And you just can't argue it. It's like, that really worked. Far more effective than any painkiller, IM, IV, or oral that I've ever given. Because
Wow.
most painkillers, when we give them in an environment like the hospital, you still have the pain, but you don't care as much. Does that make sense? It gives you a euphoric idea.
Oh.
So you still got the pain, but I don't care as much. Whereas my experience with the patches is you no longer have the pain, so you don't need to care. That makes sense?
Wow. Oh, that was powerful what you just said. Say that one more time. So when they use the drugs in the hospital setting, which you were in, they just don't care as much. So they do. Okay, say it again.
Yeah, so it puts you in a euphoric state. So for any of you ladies out there who've had children, then you might have used the gas and air. When the feedback of gas and air, I can't speak for this, I've never had a child, obviously, but gas and air with trauma is you've still got the pain, you just don't care as much. Pethidine, often I've still got the pain, Russ, I just don't care as much. Or it's you know, it's just not as 10 out of 10 in my field of, in my sensory sight.
Right.
It's not like overwhelming, but it's still there. With IceWave, the pain goes, and I don't need to care.
Wow. You love IceWave. You love IceWave like I love IceWave. I have IceWave in every vehicle. We don't leave the house without IceWave. Like, you just don't know who you're going to have to patch when you leave the house, right? Mm-hmm. So tell us your best story about, and I know you've got a lot of them because now you're just a patching machine and you're bringing all these other incredible practitioners on and your team is just growing hand over fist. But what is your best story that you've seen with IceWave? And everybody, if you're on your computer, you better get your phones out and film this. Don't make any medical claims, Russell.
Tell them about our friend that you recorded and you posted. that
Oh
works
gosh,
out.
Jane. So
Jane.
so absolutely, we can't, under no circumstances am I saying that LifeWave or IceWave will cure or heal you. What I'm saying is it will significantly reduce your symptoms, and that one of the side effects of reducing your symptoms is you will start to show significant signs of wellness, both physically and in your lab tests.
Wow.
That's what I've seen, that's what I've noticed, that's what I observe. So, hence I'm a big fan of LifeWave, because it's changing patient outcome. That's all I'm interested in as a nurse, right? So, I was a practitioner.
Right.
So, yes, so Jane. I live with Jeff. Jeff's 80, he has children. Jane's his youngest, she's about 44. So, she's had a significant injury with her shoulder previously. She was a dancer, ballerina when she was a child, moving into her adolescence, long-term injuries, and she'd significantly hurt her shoulder again by going to the gym. She'd also broken her foot about a year previously and had constant pain in her foot. So she comes to me, can't raise, she's shivering, tremoring with pain, and she's, obviously guarding a great deal. And she's had a diagnosis previously that's required hydrocortisone injections into the interior deltoid, so she can't lift it. The range of movement significantly reduced. She strained it in the gym. She's now got pain in top of her pectoralis, her chest, radiating through to her back, through her scapula, her shoulder blade, and very, very pain, in a great deal of pain, very, very affected, so shaking and a tremulous voice, etc. Oh, it really hurts, I can't really do anything. Okay, so have a chat with her. So I've got the IceWave and I had an X39. So very skeptical young lady, by the way. So I said, she trusts me, so let's put the IceWave in where the most pain is. So that would happen to be here. Pop the white one, the tan one here, white one at the back, and within 10 to 15 seconds, she's like, I can feel something. I can feel I've got some pins and needles is going. I've got warmth going through my arm, and I can move it better now. It's a lot better. She stopped shaking at this point. Her voice is no longer tremulous. It's far more together. So I'm like, okay, that's really interesting. So then popped, so I've got an X39. Let's see if we can just encourage the healing in that area. So I popped the X39 on as well. And I asked her to give me some feedback the next day. So she gives me a video the next day. And basically, so I don't know what's gone on, but I've got really good range of movement. I've just been to the gym again. I've been able to do things that I've not been able to do before. This is just 3 patches, 2 IceWave, which is 2 patches, and X39. My range of movement's amazing. It's really good. It feels fantastic. I've got no pain here at all, or at the back, and my anterior deltoid is brilliant. Can feel my hands. I've got no pins and needles or numbness any longer. It feels great, but I don't know if this is relevant. But as you know, Russ, I've had pain in my foot since it's been broken for the last year. Never got on top of it. For the first time, I've had no pain in my foot, and I've had the best night's sleep I've had in a very long time.
Wow.
One patch wonders. I love them. Come on, it's the
Me
works.
too. Me too. I always say one patch wonders never get old. When you're telling the story, I have to tell you the story of my mom's dog, Bella. You guys know Bella had something wrong with her. We didn't know. I don't know if she got stepped on by Nike or got squeezed in the door, or if we just picked her up wrong. She's only 4 pounds, right? But she's definitely had the shoulder injury, so where she couldn't jump off of anything like forward. So it was a shoulder injury. I figured out it was her left shoulder finally. Took her to the chiropractor. He put some acupuncture needles in. Those lasted about 5 seconds because she was such a wiggly worm. And I thought, you know what? I need to go home and I really need to get serious about patching her, because I had been doing X39 and Eon on the base of her neck. But when I realized I think it's her shoulders, I came home and I put a brown patch on her left shoulder, which is where the injury is, and a white one. And I'm not kidding, it wasn't happening in seconds, Russell, but it was probably in about 5 minutes. Bella was like running around the house. like nothing was wrong. Well, the other morning, and so she had that patch on. I couldn't pull it off because she's got fur, and she had had it on for about 3 days. And the other day when she was walking into the house, I thought, I gotta pull that brown patch off. She's only had the brown one still left on her body after this injury. And so I thought, I just gotta pull that brown patch off. It's just hanging by, a hair kind of. And so I kind of ripped it off when she went in the house. Within 5 minutes, she was laying in the bed, just shaking. And I was like, oh my gosh, what is wrong with Bella again? Like, this is crazy. And so then I'm getting out the CBD. I gave her CBD, didn't touch it. Half hour later, she's still in the shaking. My mom goes, she doesn't even want to come out of the bed. I'm really concerned about her. I'm like, me too. And then I thought, well, what did I do different? Well, I pulled that brown patch off her shoulder when she came in from going potty this morning, and that's when the shaking started. So I come into the office, I grab IceWave, I walk into the bedroom, I put the brown patch directly like where the last one was, even though it was not even on, it was like hanging by a thread. I put it right there and a white one on. I kid you not, in 3 minutes, Bella came running out of my mom's room, was looking for my mom like a crazy train. It was like, I was like, the IceWave is just incredible. Like, you would have to have seen it in real life. This is a dog. This is a little 4-pound dog. This is not a human that can give me feedback. But the feedback was she stopped shaking, the little tremoring because it hurt so bad. And she's not yelping anymore when she jumps down. So it's healed somewhat because she can jump down and not cry. But it was still painful enough for her to be wanting to be alone and shaking in the bedroom. And just incredible. The IceWave is, and to this day, she's running around like a bear cat, like running around. I decided I'm just not going to take that brown patch off her shoulder. Even if it's hanging by a thread, I'll just put another one on top of that one. Like, it is so dynamic and so fast with animals, you guys. Like, you got to use it. Anyway, it just made me think of that story with Bella, because this is like yesterday morning this happened, Russell, to me with the dog.
Right.
And so I'm like, these patches are incredible. We should all be using them on our pets. If we're not, like, we're crazy. Like, we got to do this. All right. Who has a question in the chat? We want to take some questions in the chat if you got them. Okay. So if you got any questions, can Russell share about patching athletes? Yes, you can, because you patch athletes, Russell.
I have patched some people who very much like German track and other athletic things. Absolutely. So I appreciate when I first met you guys, both Rita and Robin, I shared about Alan Alvin, the 3rd strongest man in the UK, 20th strongest man in the world.
Yeah, can you share that story real quick?
Yeah, so basically, Alan Alvin, called the Red Squirrel, you can look him up. Very simply, in November 2022, he was the 3rd strongest man in the UK, 20th strongest man in the world for his weight, which was 90 kilos, and shooting up the leaderboards. So in November 22, he wanted to compete in the States. He's English. And at that time, it was required to travel over your borders to have a certain intervention to be able to have access to your country. Unfortunately, within a week of having that intervention, he then was diagnosed with severe congestive cardiac failure through myocarditis. So super healthy, off the leaderboard athlete, within a week, myocarditis, severe congestive cardiac failure. So his career is over, and he's now requiring a heart transplant. So he meets me in February 23, and simply I put him on my protocol. So I don't know if this is going to help, brother, but it's not going to make you any worse. I hadn't been introduced to LifeWave at this point. And we put him on the protocol. 3 months, and his so if we talk about ejection fraction, so your left ventricle is measured on echocardiogram as an ejection fraction, and it should be 55%. 55% is pretty much anyone in health. The highest I've ever seen is 58%. That was this guy was crazy extreme, but 55% is normal. Alan's was 17%, hence he needed the heart transplant. So all the signs and symptoms of heart failure, which are horrendous. So shortness of breath on any exertion. As soon as he bent over, he got very dizzy, very short of breath, would fall, and lots of medication. Also required had an arrhythmia, atrial flutter. Again, on my website, you can see this testimonial from the horse's mouth yourself. And so after 3 months of the protocol I put him on, which is the mitochondrial uncoupling, all the 8 ways you can do that, then his ejection fraction went from 17% to 39%.
Wow.
Amazing.
Wow.
That's with mitochondrial uncoupling. So, and then by the time it comes to December, he had a pacemaker, which he absolutely needed because of the atrial flutter. But my contention is simply, if I'd been introduced to Robin, if you got to me sooner, we possibly, with the carnosine patch, could have avoided the pacemaker with Alan, but also could have got a significant further increase in his left ventricular ejection fraction within that 3-month period, because of the way that LifeWave works, because it helps mitochondrial uncoupling so much better, because it bonds with GHK-Cu, because it mobilizes stem cells, and because its policies those stem cells and make those light bulbs burn brighter, so you're shining. And then every single cell that's created as a byproduct of that shining is going to be U 2.0, 2.0, 2.0, 2.0, 2.0, 2.0. And we could have significantly got a better result. Anyway, LifeWave. He's back coaching. That's great. He's back training. That's great. When I first got the LifeWave patches, having spoke to you lovely ladies back in January, I gave him X39 for a week and then X49 for a week. And his feedback on that was absolutely off the chart. He absolutely loved them. He was like, I can go harder, stronger, faster, longer,
Yeah.
and as his rehabilitation, as I see it, is still continuing because he wants to get back. He's never going to compete at those levels again, to be honest. And why would you want to push that after that type of history? And with a pacemaker, it's unlikely he's going to compete with someone who doesn't have those issues. But the fact that he's no longer on the majority of medication, he's back training, he's back coaching at that high level, and he's got his life back, and he
And
can
he's
look
off
forward
the
to.
transplant list.
He's off the transplant list. Yeah.
Hello.
Oh.
Yeah. Amazing, amazing. Yeah. So I mean, we connect athletes all the time. I feel like there's younger and younger people coming into LifeWave on our team right now. It's very exciting, actually. I love all the 20-year-old entrepreneurs that are grabbing hold of their health, that are grabbing hold of natural health, let's just say it, instead of drugs, and that are grabbing hold of the opportunity because they want to share it with their friends who maybe are struggling with anxiety, depression. So let's talk about that. We've seen some really good things with anxiety with the patches.
Yeah,
Can you
absolutely.
tell me why that is? Because I mean, I've got a young girl that just called me. She said, thank you, Renita, for posting on social media. My mom got a diamond pack. I've been using the patches and I'm officially off my anxiety medication. And I said to Bo, it was a classmate of his. I said, she's 23. She's 23. So as much as we think that, the patches for old, sick people, like we've got these young people that are having inflammation of the brain, let's just say it, and they're having fabulous results. Can you explain why that would be so good for somebody with the patching along with anxiety or depression?
Absolutely. So what I share with everybody is we are absolutely hormone-driven animals. And the majority of our dis-ease, which we're experiencing significantly more so in the West, in the first world nations, we're the richest we've ever been, and we are the sickest we've ever been as a species. And specifically, this is because of the endocrine disrupting influences on our planet that we're basically the air we breathe, especially if you have mold in your place of domestic or work environment, water because of the sanitation process, and the agricultural chemicals that are placed on your land. So the air you breathe, the water you drink, the food you eat. That's the bad news. The good news is simply when we divorce ourselves from that, and when we're creating greater mitochondrial function through the patches, because we don't have to change anything else. My work previously to LifeWave has been changing lifestyle, which can be, frankly, forgive my French, a ball ache, as we'll say in the UK. As in, it takes a lot of discipline, it takes a lot of focus, it can take a lot of preparation to get your diet right, to get your packed lunch, etc., ready for the day, to reduce your eating window, to get your cold water exposure, to make sure you're getting heat exposure, to make sure you're going to the gym every day and you're doing your high intensity impact training. And if you're 65 and in a wheelchair, it's not a conversation for you. And if
Right.
you've got mental health issues, such as depression, anxiety, bipolar, schizophrenia, and the list goes on, and you're on medication, which is significantly affecting the way in which you're processing, then these things just seem overwhelming. So to just be able to get a patch, pop it on the back of your neck, use the other patches. We know we can use 3 different types of patches, 3 patches each. So that's potentially 10 patches a day, 1 X39 always, but we can use the Eon, we can use the IceWave, we can use the glutathione, and there are others. The energy enhancer, that's the one I was thinking of. Thank you very much. To increase energy, and in that process again of just making those light bulbs burn brighter within your cells, creating better DNA, rest, repair, and rebuilding, repairing our DNA through the 21 protein DNA repairers, which deliberately will affect our hormones. I started with hormones, we're hormone driven, and that's why my focus is always on gut health and DNA repair. So we recognize when we eat, everything we ingest comes from our mouth. So when we eat things that are really negative for us, the microbiome of our guts get very upset, and the wrong microbiome grow in the wrong areas, causing cravings. So cravings is a wonderful example of hormones. So if you're pregnant, you'll recognize that when whatever trimester you wanted gherkins and marmalade or Marmite and I don't know, goodness knows what else, chili, it's because you had cravings, and your microbiome create your cravings. So if we're addicted, if we have a high sugar intake, so we've got the microbiome that are thriving because of the sugar intake in your gut, you stop that sugar, those microbiome will scream at you, we need sugar to survive. Because if we don't get that sugar rush, our colony can't continue to grow. So simply when we so it creates the craving. I need sugar to feed that microbiome. So very simply, when we change our microbiome, we change our hormones, which immediately changes our taste buds, which is why our need for certain foods or substances is on a day-to-day necessity basis. Got to get my sugar in today, got to have my fag today, got to have that alcohol today, got to have whatever it is that feeds us negatively. So what the patch does, because stem cells are created in what's called vaginites of our gut, so you've got the soil of your gut, you've got your gut lining, and in that gut lining, just like carrots growing out of a veggie plot, instead of the soil being beneath the carrot, it's on top. Those vaginites are birthing stem cells. So if we're polishing up our stem cells, then we're changing our hormones, which will change our behaviors and the way we feel, think, and act. And over time, then if we feel better, then which is more better than the drugs will help us to feel, because we recognize the significant side effects of antidepressants and of medication for psychiatric illness. The side effects are depression. The side effects are brain fog. The side effects are low mood. It's not dealing with the problem. It's only putting, all medication, being a nurse for 30 years in clinical care, saving lives for living at the sharp end of the service, and we're only ever putting a plaster over a canker. We're just suppressing symptoms, never dealing with the cause. And the cause may be, we don't know. But the patch, because you're a nano quantum organic computer, because you're really clever in your body, your stem cells know what the key cause of all disease is: behavioral, physical, psychological. Then it will basically repair that core to then have a cascade effect. So what we see, we mentioned earlier about how long do we need to take the patch and does it have any side effects? And how do I know when it's working? Because what you'll find is, what my clients find is, say you're on the blood pressure medication that you shared earlier, Anita, you start on the patch, your blood pressure starts to come down, especially with carnosine as well. We know it's really good for heart health. Then what will we experience? We'll experience the side effects of that medication, which were the effects we were looking for. So we want to lower blood pressure, lowers the blood pressure, and now we find our blood pressure is being lowered gently anyway because of the process of healing, vascular and the bioelectric healing of the heart. Amazing. And we start to feel more dizzy when we take the medication we had. We start to feel negative side effects of, I'm more affected by the effects of this drug than I was about the reason I was given it in the first place.
Wow.
And we go back to the doctor and we say, hey, doc, whenever I take this tablet, I feel really tired. I feel really dizzy. I just can't function on it. Could we reduce the dose? And then he'll take the medication or he'll review you psychiatrically, whatever the conversation is for you. So, your symptoms seem a lot less, or your empirical symptoms, blood pressure with the blood pressure tablet, is significantly lower. Maybe we should reduce that dose for you. That is an excellent clinical decision based on data. And we see the same with any psychological, physical, and I mentioned behavioral because we recognize that the neurodivergency we see in our youth, and as I see senile dementia, Alzheimer's, and Parkinsonians, neurodivergency of our elderly, is so prolific, then we can get significant reduction in their symptoms, and we can start to pop, or rather to take away those medications, reduce the load to the point where we no longer need specific medications. Again, can't say we're not claiming we can cure anybody, but we do see consecutively that negative symptoms, presenting symptoms while we went onto a medication in the first place, reduce. And then we go back to our doctor. It's a GP, general practitioner within the UK. I don't know what it is. I imagine it'll be a doctor of some kind, wherever we are in the world. Go back to your doc. I'm getting these symptoms. There are known side effects on the label of this medication. Can we reduce that medication, please? Perfectly reasonable request. And any decent clinician will go, yeah, you've got negative side effects of this medication. We need to reduce that medication or consider removing it. Same as
Amen. That's like common sense. I'm like, if you have a common sense practitioner, that's what they're going to be talking like, right? If they're not common sense, they're going to say things like, you'll never get off of it. Find a new practitioner or hire Russell, right? One of the two things. Someone is asking a little bit about, Helen has a question, right? And somebody asked, sometimes if you gain weight, we discussed that when you gain weight, sometimes in your body, when your body is healing, it's pushing out a lot of toxins and a lot of stuff. And sometimes that may create a healing type crisis where you actually gain weight. Now, in my mom's case, she went from 99 pounds to 124, and she needed to because she was in a real frail state when she started on the patch. So I'm just always trying to increase her weight all the time. And so literally we're always working on that. So it literally did help take her to 124. And now we're doing some parasite removal stuff, which I think those damn parasites are actually stealing her nutrition. And so I'm even we're going to see greater things. I'm like, let's get you back up to 130. Come on, mom. Right. And so, because obviously the more muscle she has, the more it's protecting her bone density and all that. So Russell, Helen has a question. Helen, can she unmute herself? Robin? Or is Helen?
I think she was commenting about the heart failure patient.
Oh, okay.
Yeah.
She's got
and then
that.
she wrote it in there. Yeah.
All right. Any other? Go ahead.
I did see Heidi. So Heidi's just beneath you on my screen. Heidi had a hand up when we asked about questions earlier. Have you still got a question, Heidi?
Heidi, where are you?
Mehdi, Sarati. Oh, you're looking at me now. Sarnecki. I thought you had a question. I thought your
Oh, I was giving a pump to whatever it was you said. I was doing a yes.
Yes. She was a fist pump. She was your fist pump.
So carry on. This is good.
I'm still learning the icons. I'm still learning how to use them. All right. Any other questions for Russell? No question is, this guy will answer anything because he's so sharp. Like he knows, like the depth of knowledge here is vast. We're talking 30 plus years. So you're going to want to definitely ask the question if you have it. You're not going to want to walk away from this saying, I should have asked him that. So if you've got the question, please ask.
Okay.
Anybody.
I do have a question.
Okay.
And this came up today. I know that I've been learning that when we have chronic inflammation and we're trying to wake up these stem cells, the inflammation is just basically gobbling up those stem cells. And so it's very important to wear the Eon patch to reduce the inflammation at the same time as the X39. So the question I have, just really pretty simple. Is there a difference if, because I like to wear the Eon patch at night because it gives me great dreams and great sleep, but would it be more important to wear it during the day at the same time as the X39 if you've got chronic inflammation to help you heal faster?
Well, so the advice with the LifeWave, and ladies back me up on this, or chip in if you feel that there's anything else to add. But the advice with the LifeWave is we want to have them in the day because we want to ensure that we're drinking lots of water. Now, I know that Renita and myself are really big, and everybody else who's listened to Renita's podcast and Robin, on salts, so UNEs. So I always recommend Celtic sea salt because Celtic sea salt is the living brine of the sea. So if we're having lots of fluid and we're having lots of salt, so a pinch of water, pinch of Celtic sea salt in the water you're drinking, and we can talk about filters and RO and all that sort of stuff. But if we're hydrating really well, then we're mobilized, not only the stem cells being mobilized and the anti-inflammatory effects of the Eon being utilized, but we're circulating it around the body. Think of really clear motor oil or really gungy motor oil. Okay, so if we're dehydrated, then the fluids in our body, the blood, etc., gets really gunked up, and it's not as clean and pure. If we're really hydrated, then of course it's like Castrol GTX. I like cars, so it's really really high quality, really good oil, and really clear comparative to motor oil. So simply with that analogy, and so by having it in the day, we're hydrating more. When we're asleep, we're not hydrating as much. Now, it may be, as you say, Heidi, for you, you're like, you know what, I take the Eon at night and I sleep really well, better than I have for years, possibly, and I have great dreams and it really suits me. That's great. That's great. But for those with chronic inflammation, I, as a practitioner, I would say, let's use the LifeWave as instructed until we get that inflammation under control. Your symptoms are significantly lower. And then we can you can choose to play with the patch as an individual to see what works for you. But certainly if you're using the X39, we want to make sure that we're really hydrated and mobilizing those stem cells through the body at a far greater hydrated rate. That makes sense.
Absolutely.
Yes.
Yeah, that was great.
Absolutely. And then somebody is asking, can you switch different patches every 12 hours? Sure. Absolutely. I love to wear X39 during the day and Alavita at night. Like, I love it. You know what I mean? So, I mean, you can find what combo works best for you, and everybody's body is slightly different, but you'll know when you put it on and what the changes that you see, right? And I always believe I'm learning more and more about acupressure points and learning different acupressure points. In fact, I shared with everybody, you probably know it, Russell. I think it's BL62, bladder 62 calm sleep. And it's here, let me highlight my screen for a second. I can show you where it's at. And it's really wild because I put my mom, a patch on my mom, an Alavita, the woman who has no REM sleep. And so here's your ankle and here's your bone of your ankle. It's like right underneath in that divot of your ankle bone, right underneath it. It's called called deep sleep. You want to say something about that? Because I mean, I love to learn that. And I actually put the Alavita there. The next morning, my mom, who never has dreams, who never gets really, really, really deep sleep, said to me, Renita, I dreamt all night. And I was like, you gotta be kidding me. It was an Alavita patch on BL62. Do you know that point, Russell?
Yeah, so there are many points within with the Chinese, and there are other medical systems of acupuncture, Chinese being the most popular, hence traditional Chinese medicine. But bladder 62, stomach 36, there are a number of others that are incredibly nurturing points. So you basically press them, you can't go wrong.
Yeah.
All right. So once you've had reflexology, for example, you might be aware of the reflexologist or the massage therapist, should you have a massage, actually pressing just in the margin below the big toes, between the pads of the
Yep.
toes. That's kidney 1. Very
Yep.
popular point. Again, another great point, which is very nurturing, very grounding, kidney 1 specifically. So there are points in the body that you can basically press. You can't go wrong with them. Bladder 62 is one of them, and stomach 36, that we can just, tremendously healing. Also, bladder 62, such as you shared the location, Renita, is also, in my experience with people and also myself, is often quite very tender. So if you massage that point, you can be like, oh, that's sharp. When we put a needle in and we twist the needle in, it's like, ow. That's what we call do chi. We got chi, yay!
Yeah.
So and that's when we've actually got the meridian and we kind of like tightened it around. But it can be very, very painful. So the fact that we can patch that without putting pressure, without putting a needle on, and other areas of the body, as I said, like stomach 36, is tremendous, because it means there's no pain, you get all the benefits and none of the downsides.
Yeah, I love this. I'm bringing acupressure back. I think that, some people, I'm Christian, you know this, Russell, about me. And so I love the Lord Jesus. And I'm like, Christians are scared of acupressure. And I am taking everything back in the name of Jesus, because I believe that God designed our bodies to heal. And we have all these wonderful healing modalities on our body that we can press on, that literally helped us to calm or sleep or, all these amazing things. And people are like, oh, I'm scared of it, so I'm going to take a drug instead. I'm like, listen, you got to get your mind right. Like anything on our body that is something that we can touch and we can nurture, or like you said, it's a place that you can't go wrong with. These are the places that we need to learn about. I feel like they should be teaching this in grade school. Like, I feel like the incidence of anxiety and depression in children would be much less if they learned actually how their bodies function. Honestly, most people know more about their brand new car and how to turn on the radio than they know about their acupressure points in their body. And so I'm really on a mission to take that back and educate everybody, not just Christians. Everybody needs to know this stuff, because this is such powerful information for healing and health and well-being. So thank you for that knowledge. I'm on the journey. What's the best patch for hot flashes? You want to answer that, Russell? And then I got some feedback too.
So hot flushes, gosh, so there's so many, but I definitely think about the X39 and the Eon. Depending what your lifestyle is, then I'd want to think about, is it generally toxin related? So glutathione, major detoxifier. It may be the case that we've got some issues, depending if it's on the so I'm going to go with, it's likely to be female having hot flushes. So it may well be that we want to balance that out. And I'm going to go to you ladies, because I don't think I'm qualified gender-wise to talk about hot flushes. Has Renita left us that?
No, I just was looking at my little guy. What I think is, it's interesting because I've heard so much things around the ankle area. Let me pin myself here. And I was actually at an elite retreat in, where was I at? Maybe, no, you know what? It was in Aruba. And there was a medical doctor there in Aruba. Let me replace my pin here. And she actually was a medical doctor who specialized in female movements. And she said that anything like around the ankles, but if you go up that inner ankle right here, if this area is tender, a lot of times that's a great place to put it. Stomach, 36, like you said, Russell, which if you guys don't know where that's at, that you follow your shin bone up, and as you get to the top of that shin bone, it's off to the left-hand side. You can put a patch there, but she actually on the left leg was using SP6 on that inner ankle. So just kind of filling up in that inner ankle. If you rub it and it's slightly tender, and she used that, and she said ST36 on that inner ankle, or carnosine. She said it literally will just knock out hot flashes. And I told that to my friend Silk, Diamond and Silk. Silk is an amazing patriot. Wow, I got to shut those shades. But Silk said, Renita, the very first time I put that SP6 on that inside of my ankle, she said my hot flashes were gone and they haven't came back since. So we see a lot of really good things with SP6 patch. down on this inner ankle down here, guys. So just feel on under. I always say if you have an area that's really kind of tender and sore, I think it just needs a little more love and maybe a patch.
Hey, Renita.
Yeah.
Hey, I was just gonna say, you know, my sister, who was like the more skeptical one, she ended up getting the patches from my sister. I didn't know she was going through menopause, and she was having hot flashes, all kinds of stuff. She says 90% of all her symptoms, right when we started wearing the patch, all went away.
Yeah.
And I was
Sometimes
just
it's
totally blown away.
X39 alone. Sometimes it's X39 alone.
Yeah, for her, that's what worked. And one of the biggest things I was going to say about me is I have certain pressure points on my body that used to be kind of painful. Is that as I started patching, a lot of that really minimized and some completely went away. And one of the things the thing that I noticed the most is that, I mean, you know, I work out a lot and sometimes I go in the gym and I try to kill myself in the gym. I noticed that I'm never ever sore like I used to be. My body recovers so much faster. It's been really phenomenal.
Yeah, I absolutely agree. You're tougher to, you're not trying to kill yourself. You're tougher to kill now. Actually,
Exactly.
I word
Yeah, I
that the
feel
opposite. Every day when I work out, I'm tougher to kill. So
yeah, exactly.
because you're actually strengthening yourself. Thank you, Jaime, for sharing that.
Yeah.
Michelle Ringel is asking about the big C word, CANCER. Again, we're not making medical claims over here. We're just doing this for educational purposes. If it'd be me, I would do X39 and Eon for a season, and then I would add the glutathione after a bit of wearing X39. But X39 and Eon, if you really knew the history of Eon and why it was created, it was actually created because David met a guy that was treating cancer at Suzanne Summers' house. And that Eon patch activates the same peptide that's actually found in royal jelly, which helps the queen bees to live 50 times longer than the worker bees. But that peptide that is activated in there, the doctor that David Schmidt met down in Texas, actually the doctor's from Texas, actually when he has people come to his clinic, he's a medical doctor, it's the same peptide he gives them via IV. So David Schmidt said, wow, he's having that result with all of these people that have the C word. So David Schmidt went back to the lab and he created a patch to activate that peptide so that people don't have to be hooked up to an IV for 24 hours. And that's what's in the Eon patch. So if you didn't know that story, that's how the story goes. And so Eon, definitely Eon. And then I would use X39 as well. And then again, glutathione a little later on. Russell, any other feedback on that? Again, we can't treat, cure, prevent disease.
I've got a number of clients who are experiencing breast issues in that way, stage 1, stage 3, and they're putting the X39 directly over their tumors, and they are seeing result. And they also use the Eon, and also on glutathione. Some of them on carnosine, seeing result. Amazing.
100%, and we've seen it happen in people. I've seen the tumors be gone in people and animals both. So keep patching. I love someone chimed in. Thank you, Brenda. She said, I'm a Christian patriot from North Dakota who now lives in Colorado. She loves the Lord, but she's a certified massage therapist, and she learned the Chinese meridian points, acupressure points are amazing to facilitate the healing of the body. Exactly. God made us wonderfully. We should look at these therapies through his eyes and not the religions practiced by the therapist. Again, I always think I carry my God with me, and my God wants me well, and he wants me healed. And that's just my belief system. And so whatever modality I'm bringing in, that is my belief system. If you said to me, Renita, I've got this or that, I'm like, you know what, try this. Let's talk about these acupressure points. I'm not an expert enough, but I'm becoming a little bit better. I bought this book. I've got a couple books I bought about acupressure points handbook. It's helped me. I also this lady, I like her just because she's fun. I follow her on Facebook. I post a lot of her. She's really, really, really good. Her name is Clara Cohen. And she says, I like to make acupressure fun. And I'm like, I like you because you're fun. And so she's got like this little great book. And I've got another one from her that explains all the points. And I just like watching her because she's a real joy to learn from. And so, you don't have to get it just right, though. I've realized, like David Schmidt said, it's better just to put the patches on and get them somewhere on the body than to worry about getting it exactly right. You know what I mean? I think some people are held back with their perfectionism, and they're not going to get any better with that. So just put the patches on. And as you continue to wear them, educate yourself a little bit, try them in new spots, and and see what happens. But don't let that, oh, I don't know where to put it, hold you back. Put it anywhere. When you go to your website, you can actually hit patch placement, and it gives you a nice little starter point of where to put the patches at your website. So if you haven't been there, you can go there and look at that starter point. I don't know if you use that at all, Russell. You're too smart. You know more than the starter point, but you get the point, right?
It's
Let me see it.
It's always, I always like to, I always check and recheck just
Yeah,
to make sure, because
yeah, we're never
I mean,
done.
and you leak it out and you think, am I just making shit up now? I need to check.
I better check. Sometimes it's intuition. Sometimes when I think I just need this on there, or, you know, like my kids sometimes will say, Mom, how do you know it goes there? I'm like, you know what? I just get this like mother's intuition. And so Robin is putting your website. You guys got to go check out Russell's website. He's incredible. Russell's been a blessing to us tonight. It's really late where he's at, so we really appreciate him. His website is beingwellme.com. Go there, learn about some of these testimonies that he's saying. Is that right? Being Well Me?
No, so it's, sorry, forgive me. It's beingwell.me.
Oh, .me. I'll fix that.
Let's get that right. Let's get that right. We're going to get it right. Beingwell.me.com.
Absolutely.
Or .me is the .me is that, huh? The .me,
Yeah.
not .com, .me.
And what I'm
Love
sharing
that.
with people is simply because the information I give is actually already out there. You know, I've just put it all in one place, or have it all
Right.
in one place, right? So if people want to join LifeWave and join our team, then what I'm really happy to do is give you the advice. Get a package. I'll give you the advice for free. Get the silver package or above. I'll give you the advice for free, and then you've got to give to your clients as you build. And I'm happy to share with all the team, you know, the more information, other bits and pieces that we can do to just polish and shine up those mitochondria to help the patches work better and better, faster and faster, and be consistently healthier.
Yeah, let your light shine before men. I'm all about shine bright like a diamond. Let's go, right? And again, I always just think that when you're shining bright, it's funny. Maybe you heard me say this at some point, you guys, but when I went to the convention the very first time with LifeWave, and there was 75% of the people there were doctors, I realized, wow, there's a whole lot of doctors that are on board with this thing. And then when I was looking at everybody, I said to my husband, why is everybody glowing? Like I said, everybody is glowing here. Like it's literally like they're gold. Like they were like the golden children, right? And then I started asking people, why are you glowing? And they're like, I don't know. I use X39. I use Elavita. And I'm like, geez, like this is amazing. And now when I see people that have been on the path on my team, and I haven't seen them, let's say in 6 or 7 months, I literally run into them and I'm like, they are like shining. It's awesome. So I believe the mitochondria are getting shined up, and the patch is just helping that, Russell. So we all appreciate you so much. Everyone give a hand for Russell. He's amazing. And for Robin sponsoring him. Robin, we should have talked about how you got Russell, because you didn't know Russell before LifeWave.
No, one of my friends who came across his website because she was wanting gut health and something else, and I said, and she's on our LifeWave team, and she didn't know what to say, how to approach him. She's just using the patches, and she said, you got to talk to him because I'm pretty sure he'll know. And I reached out, and that's when I was on the airline flight, Renita, and I needed you to talk to him because I was in the middle of the air. And yeah, that's how I found him, because one of my friends found him for gut health.
Wow.
Yeah.
Yeah. And so she simply reached out, and
now we talk all the time. It's so fun. And I talk to all
Yeah.
his friends. We sign up as friends. It's so great.
Yeah. And now you're getting the whole, I mean, yeah, she's told me that you're doing these great meetings with many, many health practitioners, and they're very excited about the patch and what it's doing for them and their clients and patients. And so, Russell, you're a blessing to our team. We so appreciate you. You are shining brightly. Everybody, check out that website. We put it in the chat there. If you want to hire Russell, you can even do that. beingwell.me to increase your mitochondrial functioning. Or if you know somebody that is sick of their doctor just pushing more drugs, how about to get a hold of Russell? He might have some different options for you. So with that being said, may the Lord bless all of you and shine his face greatly upon all of you. Thank you so much. Robin, what did you say to Russell when you reached out to him? You said, Russell, I think I got something you might want to look at.
Yeah, I did, right? Didn't I say that? I said,
exactly.
I think I said, this could replace what you're doing. I think I said that. I was very bold. Wasn't I
And
very
you were
bold?
right. You were
Yeah.
right. You know, genuinely, with all the stuff I've done, all the stuff I've learned, all the years of whatever I've been doing stuff, there's 8 ways to mitochondrial couple. I say a ninth is meditation because it changes your genes, but the missing link, genuinely, which is why I'm with LifeWave, is LifeWave.
Oh,
The fact that
wow.
we can release these peptides, which because often people will be doing my program as I've shared,
Yeah.
but they're and they've been here for months and been really strategic, but their mitochondria are still not methylating. Their mitochondrial function is still low despite doing everything correctly.
Wow.
The LifeWave, it changes it.
Boom. Wow, Russell.
Time disrupting influences on the planet. LifeWave helps to reverse that more as powerfully as anything else. And I believe personally it is the difference between getting healthy and being healthy. Otherwise, I wouldn't be in this conversation with you if I didn't believe that to be the case.
Wow,
Russell,
I know.
somebody texted me and asked, when their doctor sees them wearing the patches, what should they say to them?
Tell them the truth. I'm wearing these patches. It's light therapy. It's like red light therapy in a patch.
Mm-hmm.
And you know, get and send them the link X39. You know, this is it, X39.
Yeah.
And we need to educate. We need to educate everybody, but most importantly, we need to be educating so I was a healthcare professional. I wasn't a healthcare professional. I was a disease management consultant.
Wow.
So healthcare professionals are actually disease management consultants because we're not interested in people's health, but we're very interested in your disease, not at a practitioner level, but at the pharmaceutical level, and those who just look at numbers rather than people.
Wow.
So we need to be significantly educating as many of the frontline workers, your doctor, your nurse, your physio, your occupational therapist.
You gotta say this again, Russell, because I gotta film it was too good and I can't get it just right. What, you know, you were in that realm of being a critical care nurse and all that. So,
Yeah.
what is
So
the industry that we're in here now? What
so
is this about?
basically, you know, so nurses, doctors, certainly in the UK, certainly in the West, we sell ourselves as healthcare professionals, but we're not. We're disease management consultants.
Wow.
Pharmaceuticals and surgery and chemo and radio. Bless it. Thank you for being our lives, showing us what doesn't work as well as other things. And for those who've had success with that, I was so pleased for you. But we recognize that that success can be often short-lived. And because of the 1933 Cancer Act, we can't say we can cure anything because, unfortunately, those who dominate and monopolize the health system can't. So, because they can't, no one else can, in their opinion, which is the law. So, but we're disease management consultants. Be under no illusion. If you look at most people in the NHS, practitioners, nurses, doctors, and you reflect their health back at you, you're thinking, they're overweight, they've got high blood pressure, they're eating carbs, eating caffeine in the hospital foyer. You know, we're not selling health food in hospitals, are we?
No.
Right?
Hello. Oh my gosh.
Hello. So
Yeah.
we need to basically recognize that the more we can influence through education, through the power of light therapy, which is LifeWave, it's the only product on the planet that does what it does. There's no competition. God bless David Schmidt. He's absolutely nailed it, patented it. How many patents? Hundreds. How many research papers? Thousands. Phototherapy and also LifeWave. And how many testimonials over the last 20 years? And the testimonials for me, which the medical profession says, oh, it's only a testimonial, that's anecdotal. Well, it's actually the patient's experience that matters the most. It's not what you lab, it's what happens in the field. And in the field, in the day-to-day people's lives, LifeWave is the most effective thing that I have found in all my years of practice and all my study that doesn't require you to be uncomfortable, doesn't require you to take medication that's got side effects, doesn't require you to do, I don't know, a 3-month, 4-month, 5-month, 6-month detox. You can just put a patch on, go about your day, drink some water, and you find results over time. There's
Wow.
nothing like it on the planet. And as you find those results, you feel better. So now you don't feel as overwhelmed with your health, and you can start making that healthier choice when you're in the grocery, when you're in the coffee shop, when you're out and about with friends. Do you want some more pie? Do you know what? I'm going to stick with this drink rather than have, all these things, because you want to get better because you feel better from within. And
Yes.
my experience with clients and patients, specifically patients as a nurse, you start making them feel better, which is why I'm such a big advocate of the IceWave. And patient and practitioners see the difference in their patients through patching. It's a no-brainer.
Wow, wow, wow. We can't get any better than what he just said. We're going to leave it at that. Russell, thank you, thank you, thank you, thank you for just your
Yeah,
light
thank
and
you,
your
Russell.
knowledge and your wisdom
Thank
and your
you.
heart. And get a hold of Russell if you guys want more of this great education and dedication to you and your health journey. He's amazing. What else can we say? Robin, we love you. Russell, we love you. We
Yeah.
appreciate both of you.
Thank you,
Have a
Lisa.
great night, everybody. And this,
Awesome.
yes, recording will be posted in our Facebook group. Have a great night, everybody, and get some sleep, Russell. It's late over there.
God bless you. Bye-bye, guys. Thank you
bless
so
you.
much for
Bye.
this evening.
Have a good night.
Bye.
Bye-bye.
Bye-bye.
Thank you.